National Blindness Survey revealed that cataracts is responsible for over 50% of blindness in the country, with millions more at risk. The condition affects rural communities, women, and elderly, widening existing health disparities. So, if you're listening to my voice on the other end of the radio, like I said, you're free to ask lots of questions as regards this particular situation. Okay. All right. So stay tuned. Stay with us. All right, without further ado, let's get right onto it. No need to wait around anymore. Amaka, good morning to you. You're looking beautiful this morning. How is it going?
Oh, it's going well. Good
No,
morning.
you're all smiles.
Kimberly.
Yes, good to have you. Good to have you on Super FM.
Thanks for having me today.
Yeah, and it's beautiful, particularly beautiful having a female doctor. Usually, I have male doctors in cataracts and then glaucoma.
Glaucoma, yeah.
Okay, yes. So let's kick things off for the next 15 to 20 minutes talking about cataract. So what is cataract?
Okay, so we you said cataract glaucoma. Most times most of my patients, they come to the clinic and they end up mistaking cataract for glaucoma. So I'm like, is it not the same thing? I'm like, no, it's not the same thing. So let me just give us a brief rundown about cataract. So normally cataracts occurs when the lens at the back of the eye, that is inside the eye, the transparent part gets cloudy over time. So the opacity normally clouds the lens.
Okay.
So that is when cataract occurs.
Okay.
Yeah.
So what is responsible for that white thing that grows on top of the eyeballs? Like when you see it cover?
Okay, white thing that grows on top. Okay, most times it's not the eyeball. Most times when you that white thing is normally on the lens, but it normally reflects as white. Like when you just see the eye, you see it white. And most times that is when the cataract is matured, that it gives that white cast.
Okay.
It's just on the lens, because the structures of the eye, we have the eyeball, and for that eyeball then we now have the iris.
Okay.
So the iris is that colored black brown part. So before that iris, we already have the cornea, which is the transparent part just in front of the eye. So that pupil part, the pinpoint part in the middle, that is where the lens is. So that's where we see that white cloudy. So most times that is the presentation of cataract when it's matured. So what normally causes it is accumulation of proteins over time that they break down and they just come together. So the thing about cataract, it doesn't just happen all of a sudden, except maybe in a case of trauma, injury to the eye. So cataract is like gradual.
It's a gradual thing.
Yes, it's a gradual
comes up
thing.
gradually. So
Yes.
how prevalent is it? Because I know I see it a lot, in Lagos and across Nigeria.
Yes.
People with the white thing. So how prevalent is it in your practice? How often do you?
It's very common, especially when we go for this community health outreach. You see people come, I feel my vision is cloudy. It's very, very common, like very common.
It's very common.
Yes, especially people who are more than maybe 50 years.
From 50 and above. But I've even seen people that
Even
look
for-
younger than 50
Yes,
coming up with
I
it.
had a case. I think I know a guy. He was about 30-something years, and he already came down with cataract. So we now discovered that he was also diabetic, because that one is also a risk factor for developing cataract.
Okay, so talking about the risk factors now, what are the risk factors associated with it?
Okay, some of the risk factors for cataract: age, number one. You see some people say, but I'm not old now.
And then you're having it.
Yes,
so-
age, number one. Because over time, there's accumulation of the proteins, nutrients, everything that you are eating. It goes here, it just accumulates and clouds the lens. Then another risk factor for cataract, like I mentioned earlier, diabetes. That is, we know diabetes now, when the blood sugar
Yeah,
level
the
is
blood
not
sugar.
controlled.
Yeah.
Exactly. That one is another risk factor. Then another one is injury to the eye, trauma to the eye, or maybe you must have done maybe past eye surgeries. That one can actually cause it. Then exposing our eyes to sunlight.
How can we do without that?
Okay, for which?
No, like exposing the eyes to sunlight can actually cause cataract.
Yes, it can cause cataract.
Okay.
Okay. For that one, basically, when you're outside, you should have your protective glasses on. It's either sunglasses. Just make sure you are protecting your eyes. Then smoking, excess. Most of this smoking, alcohol. All
Lifestyle.
Those ones. Yes,
so lifestyle.
Yes, exactly. Can cause cataract.
All right. So, what about genetics? Is it something
genetics? Yes.
So
yes.
It's hereditary.
Yes,
Something that
it
you
could
can
be
get.
hereditary. Yes, because I see some of my patients. Oh, when you check their eyes and you see, oh, they're already having signs of cataract, and from their history, when I ask them question like, oh, is it in your family? They'll say yes. My dad, my mom had cataract. My brother. So it's actually hereditary.
Yeah. Okay. So protein accumulating in the eyes. How can one do without eating protein if it's going to build up in the eyes?
Not just protein. Different nutrients, because most times we normally recommend for patients who are already developing cataracts. We normally recommend what we call antioxidants, that is eye supplement. So most times most of this the thing about these antioxidants, they normally like reduce the breakdown of like all those harmful substances. So most times it's these harmful substances that they accumulate and like cloud the lens.
Okay.
But some people, they can't necessarily avoid it.
They can't avoid it.
Yeah.
It's unavoidable. So if you're eating the protein, just be ready. No, but then, it's important.
But some people, they are lucky enough to escape having cataract in their lifetime.
Yeah. All right. So now let's talk about the symptoms of cataracts. How do you know? Are there early symptoms?
Yes.
Okay. So what are some symptoms?
Okay. Oh, well.
And are there, sorry to jump in there, are there types of cataracts? Because when I was trying to research on it, I saw cataracts. Is it like one, or there are different types of cataracts?
We have different types of cataracts based on the presentation. When we we have stick lamp. So when we use it to check, then we have different based on the presentation of the cataract. Some you find them at the edges, some at the center. So until we do all those ones before we will not know and be able to classify the type of cataract.
Okay, does the risk factor determine the type? Is it connected, or it just comes?
No, it just comes. It depends on where the accumulation of the whole thing stays. Some it's even everywhere. Some may just be at the around
the
like
place.
that.
Okay.
Yeah.
So which is common in our climate? What type is more common?
I would say nuclear. Okay, the nuclear one, that is the center one. Then there's another one we call the posterior subcapsular cataracts.
That grammar. Okay. All right. So we'll just try to break. Sometimes it's difficult to relate to some big grammar when it comes to medical. No, but when you're diagnosing your patients, do you use big grammars as well? Like
I
when
try
you're
as much as possible not to
keep it down, so that I can
try
understand.
as much as possible to break it down.
Because we have to, we have to understand what's going on. Because then I'll just be lost. Like, oh, yeah. So now let's talk about the symptoms. And do they present in stages? Is it something that comes like, are there early symptoms, mid symptoms, post late symptoms?
Well, I would just be giving us just the general symptoms. I won't really classify them.
Okay, no early symptoms.
Okay. Early symptoms. Some people, they just complain they have this reduced vision. They just notice all of a sudden that the way they used to see before, they don't really see like that anymore. Like it's like there's this drop in their vision.
Okay.
All that. Yes. So
isn't that same with all eye issues?
Yeah, it is.
Okay. So are there other symptoms like headaches or malaria?
No.
Like fever. Let me not say malaria. Okay. So it's just blurred vision.
Blurred vision. And when you talk about the blurry vision, it's not just blurred vision. It has this Amatan. When you wake up in the morning, this dew like vision. Most times they complain. Some even tell you, I feel cotton is covering my eye. Something like that.
Okay.
Then some when they come to the clinic, you notice that today you give them these glasses, they are fine with it. Before you know, next time they come, it's like, oh, they cannot use that same glasses again. So their glasses prescription keeps changing.
Okay.
Then some, you see, they complain that, oh, they need more light to read. They find it difficult to see when there's not enough light.
Okay.
Then you see some, when they come, they tell you that, oh, they experience this scattering of light, like at night. So they find it difficult to drive. Yes,
Okay, at
because
night.
of that scattering of light. Light scatters. Because what the cataract does, it just makes light. You know, it's everywhere sometimes. So it just like scatters the light. Because it doesn't make the light to pass through that lens to get to the back of the eye for them to
Okay.
have clear vision.
Clear vision.
Yes. Then some, you see them, they say that, oh, when I close one eye, it's like the other eye, I'm having this double vision. Like I'm seeing two instead of one. Yes.
Yeah.
Some will tell you, oh, if I look at light, it's like I see rainbow. Like,
Wow.
yeah,
That's serious.
around the light.
Okay.
Yes.
Okay.
There's, okay, some will tell you, there's this yellowing of colors. It's like colors, they just look
Yeah,
yellow
yeah.
and all that. Yeah.
Okay, so do you get to detect this in early stages, or it's only when it gets to the point where the eyeball is already clouded?
No, we can detect it in early stages. We
Okay.
can. We
Okay.
can.
All right. So,
Yeah.
how is the diagnosis done? Is it blood test or?
Okay, first of all, when the patient comes, we normally take their history. So from taking the history, we know, oh, are you diabetic? We start from there. Do you have an increased blood sugar level? We can start from there. Then another thing, oh, the patient, the way they say, oh, my vision, I think, is blurry. So when they come and we check them, first of all, we want to know the vision in their eye. So when we see this reduced vision, we now know that, oh, it's like, oh, it's possible something is already happening. So we sometimes check, oh, will there be improvements with glasses or not based on this reduced vision. Sure, you understand.
Okay.
Then
Alright.
from there, we now check the back of the eye. So we have our instruments we use to check the back of the eye. So when we check, the lens appears cloudy. That one is our area.
Okay, that's the
Yeah,
area.
that's
Okay.
our
All right.
So when we check, we now say, okay, it's cloudy. Then from there, you can now know, oh, it's like there's already early lens opacity setting in. There's already early clouding of the lens. So
Okay.
from there, we now go ahead. We can decide to still check other structures in the eye.
Okay.
We can check the pressure of the eye and all that. Then another thing, when we now do our test, glasses test, to try and get the patient's prescription, for some people, the glasses may improve their vision. So when
Okay.
the glasses improves their vision, for the meantime, they can be using that glasses. Yes,
Okay.
they can be using that glasses to be able to see better and just help to focus the light a bit at the back of the eye,
Okay.
because their lens is not completely clouded. It's not
Clouded.
completely white.
Mm.
Sure, you understand.
mhm.
So, but over time, the more the cataract gets matured, the more their vision gets more and more blurry, and that lens may become ineffective. So they may have to go for like other options.
Okay, so you
Yeah.
talked about you check for diabetes, but what's the correlation? Let's see, we have this call here. Hello, good morning.
Hello, good morning.
Good morning to you. What's your name and where are you calling from?
Okay, I'm Kelechi calling from Iba.
All right then. What's your question?
Okay, I want to know people that have family history of cataract, how do they handle it? How do they handle the cataract development?
Okay.
Okay.
All right. She's asking for the history. How do you handle? Well, I think we're going to get to the prevention parts
Yes,
right
we
on the
will.
program, right?
Yes.
While we're going on, so you're talking about the fact that you check for diabetes and all
Yes.
that. So what's the correlation? Like, how do they? Are there other illnesses that lead to cataract?
It's mainly diabetes. Me, I'm fully aware of.
Okay, it's just
I'm not
diabetes, you're aware.
There are other things. Even having glaucoma
Yeah.
can even predispose one to cataract.
To cataract.
Even some take you medications, like you just this self medication, steroids can
Those
even
things can.
predispose.
Okay,
Yes,
so
can
that's like the
predispose one.
downside of abusing medications.
Yes, self medication.
Okay, so what are some challenges you get to encounter? You talked about going for community outreach and seeing it very prevalent in rural communities. We hear that it's very, very prevalent.
Yes, it's very prevalent.
And even I think with the elderly as well. And like you said, so what are some challenges you get to encounter? Like, what makes it more difficult to diagnose or treat cataract?
Okay, for those
for
rural.
for your generally, is it that patients don't come to you guys early enough?
You know the way Nigeria is now.
Okay.
People hardly go to check their eye. It's only when you check your eye, even the early stages, you can't detect it from outside.
Okay.
It's only when you go to the clinic that we're able to see. Even sometimes we just see it and we just alert the patient that, oh, cataract is already developing in your eye. But for now, there's no cause for alarm.
Yeah.
Just leave it. Just continue to use your glasses. Always come back to the clinic so that we can check the progression and everything. You won't see some, they're already coming. Their vision is very good. Like, they can see very well. Like, even with glasses or without glasses. And once they've already gone to some places and they tell them, oh, you have cataract. And they come and they're like, oh, doctor, I just want to seek second opinion. Am I supposed to go ahead and do surgery? And I'm like, calm down.
Yeah, it's not always just
Yes,
surgery.
I'm like, no, I'm like, calm down. Just leave your eyes. Just enjoy your vision for the meantime. Use your glasses. Then when it's time for surgery, we will definitely let you know. Yeah.
Right. Okay, so people actually come early. You said that's
Yes,
not,
they
that's
come
not a
early because
challenge.
they just want to abeg. Let me just quickly remove this thing and continue my life.
Okay, so now you talked about the treatments, that it's in stages, depends on the severity of the
Yes, it
cataract.
depends.
Okay, so how accessible is this eye condition care in Nigeria? Is it something that you say is accessible, especially for people in rural communities?
Yeah.
And
Okay, I would say it's becoming more accessible because when I look around, I just see free medical surgeries. They are doing surgeries for 100 people. It's becoming more accessible than before. So you see some people, they'll say, oh, I went to this facility, they were doing free eye surgery and they didn't really pay money, and clinics are even subsidizing the rate for the surgery for people. So it's becoming very accessible.
And even the surgeries for this eye condition, most of them are carried out here in Nigeria. Like,
Yes,
it's not something
yes,
that people travel out to do.
Yes.
All right, so we're talking about, let's move on to prevention now and management. Let's say a patient comes down with cataract.
Okay.
How do you prevent it, first of all, before we talk about the management? So how do you prevent cataract?
Okay. First of all, to prevent cataracts, first of all, always go to the eye clinic. That one, emphasis on that. Then, secondly, if you're somebody that you walk maybe like in a maybe dangerous environment, always protect your eyes, because I said eye injury can also result to cataract. We call that one traumatic cataract.
Okay.
So always protect your eyes. Always make sure you have something to protect your eyes. When you're under the sun, always protect your eyes. Then if you have other health conditions, like, always make sure you take your medications, you visit your general doctor to always check yourself and everything.
Okay.
Yes, always make sure.
Okay, but the question that was put to you earlier is that how do you check the development of it when it's hereditary? When you know that you have how many people really go for eye checkup care in the country as it is? A lot of people don't really go for it.
Yes, I know.
I think it's only the rich, right?
It's the it's only when your eyes starts paining you cannot see.
Yes, but like how often should one go for eye
test.
checkup?
Okay.
Yes, like check your eyes.
Okay.
What's
If you can
recommended?
actually do biannual, that is 2 times a year. I think you have
times a
actually
year.
tried. Yes.
Okay.
Yes, I think you have tried.
Okay. So let's say it's genetic, how do you then prevent yourself from coming down with it?
Something that is genetic.
No, it's possible.
I understand,
but
like,
if
it's in your family already now.
No, but you can't just give up. Hello.
No, you can't give up now.
Hello.
Hello.
Hi. Good morning.
How you doing?
I'm fine, thank you. What's the name?
My name is Okoko Stanley.
Stanley. Where are you calling from?
I'm calling from Iba, Lagos.
Okay. What's your question?
I want to ask you, can supplements like vitamin C or omega-3 delay cataract development?
Okay. All right. Did you get a question?
I didn't get it.
Okay, you can't hear.
No, I
okay,
can't
so
hear.
it's asking that supplements. Although I thought doctors are actively against supplements. Is that something?
No, we
you'd
have
want
some
to
very
clear?
good eye supplements. Like some.
No, you don't need to call the name, but generally, I heard doctors say that
Yeah, it doesn't
it's
do
not, it
much.
doesn't. The body just takes what it needs and lets the others go. I don't know.
Yeah.
So, but he's asking that vitamin C and
Yes, yes, very necessary.
omega
Those
3.
things, yes, because yes,
Okay.
yes,
Okay.
because
Those ones
I read somewhere they said vitamin C normally helps with like reduce this age-related cataracts. Like yes, it helps.
Okay.
Yes.
All right. So you said something that is genetics. Nothing can be done about it. Just hand over your case.
Nothing can be done if it's already in your family.
No, but we can't
Yeah,
give up. We
actually.
can't
But
just
we
give
can't
up like
give up.
that.
So when you know you have some eye conditions in your family, definitely you shouldn't be the number one person to run to the clinic so
To
that you
always
check your eye. You make sure that that yes, your eyes, everything are intact and everything.
yeah.
Yes. Yes.
You won't come down with it,
You
right?
don't come down with it, and even if you come down with it, you are able to detect it in the early stages.
In the early stages.
Yes.
Okay. All right. So the treatment is usually just drugs, medication, glasses.
Okay. First of all, we start with glasses.
Okay.
That is, if there's improvements, there's still improvement with vision, we can start with glasses. Then eye drop. Oh well, even if you end up using eye drop to like
prescribed eye
slow
drop, right?
down the
Yeah.
progression of cataract,
Yeah.
you may still end up doing the surgery. Most
Okay.
times, the final bus stop for cataract is surgery.
Most
Yes.
times.
Yes,
Okay. Is it
yes.
something that is treatable? Like, is it something that is there? A
Yes,
cure
if
to it?
detected early. If detected early, like vision, most what WHO said, they said irreversible, that is reversible loss of vision, because sometimes the vision lost by cataract can be recovered.
Okay.
Yes, because when they do the surgery, what they do for the surgery, that lens that is cloudy
Mm-hmm.
is the
They wash it.
ophthalmologists that normally do surgery. I don't do the
Okay.
surgery.
you
Yes.
don't do- Okay.
So yes, so that lens that is cloudy is like they remove it, then they now replace it with artificial lens. Yes, so when they replace it, the patient may see to an extent better than what they were seeing before. And sometimes they may still see, but they may still need glasses to still like give them the best vision.
Okay.
Yes. So surgery is like the final bus stop.
The
for
final
that.
bus stop
Yes.
of it.
Yeah.
All right, and it has to be by a professional, not just
Yes, it has to
anybody.
be.
Not anybody
Yes,
that owns a
yes.
chemist can just
No.
perform surgery on
You see some people
someone
they will
with
say they went
cataracts.
to meet one aboki to go and do.
And the abuki will go carry out the surgery.
I don't even know how they even gain
How do you-
expertise in doing
And
all that.
are there successful cases when you
Huh.
well you've never heard of that? Because how do you present your eyes on the road? No, but that's not. The thing is, well, it's good that you're putting clarity that it's only the optometrist.
The
and
ophthalmologists, yeah, the ones that do the
ophthalmologists are
surgery.
the ones
Yes.
that do it.
Yes.
Okay, so you said it's not exactly treatable. It's manageable. Is that what it is? Does it grow back?
Yes, for some cases it goes back. You see the cataract coming back. So when it comes back, because what I've noticed, maybe they have different types of surgery. they have one that they use laser to do. That one is way more expensive. Then they just have the small incision. The ophthalmologist, that is
They
their
know
work.
what
They
to
know
do.
how
That's
they do
their
it.
field.
So most times we see people that do that first one. Some of them may come back to the clinic and you see, oh, they're already developing that cataract again. So we now refer them to the ophthalmologist so that that laser they didn't do initially. So they now end up doing it again.
Okay, I don't know who's calling on a voice call on the WhatsApp number, but you can call the studio line on 0805 092 0927 or 0705 890 4927 if you have eye condition and disease related questions. Okay, let's take a break now and then talk about glaucoma. I always hear about glaucoma, and I hear that it's a silent
thief of sight.
silent thief of sight. So just the same questions I asked you. First of all, what is glaucoma?
Okay, so for glaucoma normally occurs when there's damage, like it's degenerative changes that happens, like when there's damage to the back of the eye. So we have the optic nerve, and normally this is like the connection between the eye and the brain. So what glaucoma tries to do when it's present, it tries to like disturb that connection.
Okay.
Because most times we see with our eyes. So when we see with our eye, it's the brain that will not interpret what that eye is seeing. So what glaucoma tries to do, it wants to cut that connection. It's like there's sight, but there's no vision.
There's no vision.
Yes.
Okay, so cataract is blocking it, but glaucoma is
Yes, the
cutting
lens. Yes, and
Okay.
For glaucoma, it's like it affects inside, like the back of the eye. You know, I said for cataract, it's basically the lens that is
The
affected.
lens is
yes.
affected. Okay, so but what are the risk factors for glaucoma?
Okay. Risk factors, number one, family history.
Everything is
It's
family.
hereditary.
That's why you
Yeah,
should look out for who you
glaucoma
are
is
starting a family
very
with.
glaucoma is
No, but
very
everyone
hereditary.
deserves, love and connection. But then that's why
Yeah.
you need to look out for who you're starting the family with, because most
Exactly.
of the cases we get, glaucoma, you said risk factor is family, and
Yeah.
what other risk factor?
Okay, we normally have some eye conditions like refractive errors. So the thing about refractive errors, that is the lights that falls on that is supposed to fall at the back of the being short-sighted. They are able to see things at close, but at far they can't really appreciate it. Yes,
Okay.
that is a risk factor. That is myopia. Again, being
Okay.
short-sighted is
Okay.
a risk factor
Okay.
for glaucoma. Then use of some medications like steroids too.
Okay.
Yes,
When you abuse
then-
medicate. Okay.
If okay, this is why it's very important to go to the clinic to always check your eye. This increase in the pressure of the eye too, that one is also a risk factor for developing glaucoma. Then injury to the eye too, some surgeries can also predispose
Causes.
one. Yes.
Okay. All right. So you
Then
talked about you said age as well.
to age very
Okay.
important.
So how common
even
what
even being African too.
okay, being
yes,
black.
Yes, it's more common in blacks than
Okay, why is that the case?
Caucasians.
Why is that the case of it?
well, I think because of the way
God
God's
made us.
created.
Is there a
our eyes.
particular thing in our body that causes it? That just makes you don't Okay. So what are the common symptoms of glaucoma?
Oh well.
Are there early symptoms? Are there maybe later symptoms? All right, the person trying to call on WhatsApp sent a message
Okay.
in, says, "Good morning to you. This is Tunde from Ikotun. Please, if somebody has glaucoma and eventually cataract on the two eyes, wow, what caused it and what can somebody do? Thank you." So is it
Okay, yes, it's possible to have, but we call it complicated cataract. But the sad thing now is that if somebody has glaucoma inside the eye and cataract at the back, even if sometimes so, it's like 50-50. Even if they end up doing the cataract surgery, the person may not be able to see. So it depends on the stage the glaucoma is at the back of the eye. If the glaucoma has gotten to advanced stage, the person may not still be able to see, even after doing that cataract surgery. So it's very,
okay?
very possible.
So how does Tunde know he has glaucoma? Has it been diagnosed already? Tunde, how do you well, I don't if that answers your question. You can actually send more so
Yes,
that
you
the
can send
doctor
more.
can answer more questions. But now why is it called the silent thief of sight?
Okay, well, you asked earlier about symptoms. So, in the early stages, glaucoma doesn't have symptoms.
Okay.
Yes, it doesn't have symptoms. It's only if you go to the eye clinic that you will know if you are a suspect for glaucoma or you already have it. Yes,
Okay.
it's only it doesn't have this thing. Some people now they'll just say all of a sudden, oh, I just slept and I just woke up and I just noticed I'm not seeing with my eyes again, or I just noticed reduced vision. Like I close one eye, it's clear. I try to see with the other eye, it's like it's blurry.
So the only symptoms is reduced vision.
Yes,
and
reduced vision.
headaches. Okay. Does it come with cataracts just like the question that came in? Is it usually do they come together?
No, the different stages. Maybe glaucoma is already there developing, and maybe it's age something now. Maybe somebody that is above 50 now, all of a sudden, before you know, the cataract is already developing. Yes.
Okay. All right. So how is it diagnosed? Is it the same with
Okay.
cataract
For
for glaucoma?
okay. So for glaucoma, when you come, we check your vision. We want to know, how well are you seeing? Then from there, we know, okay, can glasses improve the vision? Then we check the back of the eye. So that one is very important. We use our
Okay.
instrument to check the back. We want to check the nerves. Do they look healthy? Do they look suspicious? Then from there, we know should we send for that test. So we have a ratio we normally use to grade when we check the nerves at the back of the eye.
Okay.
So from that ratio, we have different degree. So from there, we're able to know that, is this eye that is likely to have glaucoma in the long run? Then we check the eye pressure, very important. So normally we have a range we normally use to know if, okay, the pressure. So we normally check the eye pressure, and we normally work with the range of 10 to about 21. So when we check the eye pressure and it's way above that, then from there we say, oh, okay, hypertension, that is the pressure inside the eye, the pressure of the fluid inside the eye is a bit high. So we now, from there, we can now say, oh, okay, let's just send you for further tests. We can send for a scan. We want to really check, like, have a very good.
So how cheap are these no no, we have to be sure.
I know,
Because we can't afford to go blind just because we can't afford. So how cheap are these tests for cataracts and glaucoma?
Especially glaucoma.
Is glaucoma cheap? When you say especially glaucoma,
Well, I would say it's affordable.
affordable is relative.
It's relative, exactly.
So on a scale of, is it 5,000? Is it 10,000?
No,
is it
it's
1,000?
not. It's more than that.
It's
That's
more
the
than
thing.
that.
But at least, thankfully, we have HMOs, all these health management organization that are helping they are released to like subsidize the price for the tests and everything.
Okay.
Yes.
All right. So how effective are the health insurance when it comes to accessing eye
I would
care?
say for my clinic, Ultimate Eye Clinic, where I work, I would say they are really, really trying.
Yeah, but the
really,
health
really helping
insurance in the country, like how does it encourage?
people to.
Is it encouraging when it comes to eye care?
Yes.
Do a lot of eye clinics get to partner with health
Yes,
insurance?
some and health management organizations are really, really trying. They're really, really
They're
doing well.
trying their
Yes.
best. All right, so he sent a question back, Tunde from Ikotun. He said, I've been diagnosed since 2010,
Okay.
14 years ago, and I've been using, he called out the drugs, but that's not
Okay.
allowed. But he said, I suppose to have done shunned operations, but I'm not
Yes,
seeing
surgery.
my fingers right now.
Okay.
Cataracts has come up again.
Okay.
All right. So I think he said he was diagnosed in 2010 for glaucoma and
Okay.
eventually cataract. So does glaucoma lead to cataract? Like, what's the...
Yes, it does.
Okay. All right. So, but I know a lady that has glaucoma, but there's no white thing in her eyes. Are there different types of glaucoma?
Okay. For glaucoma, there's no whiting. No. Like somebody that actually has glaucoma and the person cannot see, like the person is actually blind, you won't even know because the person's eyeball, everything will still be intact, but the person is not seeing. Remember I said there's sight, like the eye is, everything is intact, but the person is not seeing. It's only when we do our test we will not see, oh, this person's pressure is high. This person cannot really read the letters on the
Hello, good
charts.
morning. All right, please try to call back. I'm trying to ask as much as I can when it comes to cataracts and glaucoma. I've always heard about this, and as scary as it may sound, that when you hear that glaucoma does not have any symptom and it just creeps up on you, you just wake up one day, you lose your
Scary,
sight.
yeah.
But are there bacteria? Are there things that cause it? Is it something that is eating the...
It's in the eye.
What do you want me to say?
It's
I'm
no,
asking layman
even for
questions.
even for us as
You don't
eye
understand.
health practitioners, it's really scary.
Yeah.
There are
so
some patients I just see and I get all emotional because I'm like, you have all the money in the world, but like even like having all the money in the world, once glaucoma has made one blind, it's like even if you like buy all the medications,
so there's no
it cannot
treatment.
be recovered. There's no cure, but there's treatment if detected early.
Okay. All right. Okay, so I was asking about how expensive, and I don't think we've answered his question
Okay.
exactly.
it?
So I think we should answer his question. The guy from Ikotun.
Okay.
He asked
the-
about. Hello, good morning. Hello, good morning. Hello. All right, so you can call 0805 092 0927 or 0705 890 4927. You can send a WhatsApp message alternatively to 0705 690 0927. Hello, good morning. Hello, good morning. Okay. All right. So hopefully that's
Okay.
not glaucoma for the. Okay. So now, as much as we're laughing about this, it's actually very serious, you know.
Yeah,
And
it's
so, what are
serious.
some research in your field? Exactly. You're saying now that even you guys that are in the practice don't exactly understand
Yes, we're
what's.
still trying to understand.
So how far? What
the-
progress have you made with the research? When it comes to.
I'm not the one doing the research. You know, we have so many health issues we are still trying to
No,
do
but-
research about. So glaucoma is just one of them.
No, but that's your.
Yes.
But I'm sure that at some point in school. Okay, but let's answer. He said this guy has been diagnosed since 2010, 14 years ago. He's using
Okay.
medication and the Sean's operations.
Okay,
and
has
he's
he
not
done the
seeing his
operation?
fingers. No, he said he's supposed to have done the Sean operations.
Wow, we would have done it. Okay.
Yeah, but he said the cataracts has come up again. So what's
Okay.
the fate of Tunde now?
Oh well, I don't know the extent of the glaucoma now at the back of the eye. So from knowing the extent, the stage of the glaucoma, how advanced it has gotten to, so I can't really say the prognosis, the improvement for now. And he said cataract has come back. So most times, what they do, they'll first of all have to work on cataracts in front before you can get to the back, because you have to break through before you get ahead to the back of the eye. So I really don't know the extent, but I'm sure for them to have recommended this surgery for you, you must actually have needed it, because most times surgery is always like the last for glaucoma. For treatment of glaucoma, we normally do eye drops medication first, especially
Okay.
when your pressure for your eye is repeatedly high. So most times we normally do eye drops before we now recommend surgery. So I'm sure for them to have recommended surgery, I really don't know the extent for the.
Okay, so what are some other very common eye conditions that you think should be brought to the fore?
Okay. Okay. Well, we have refractive errors. You know, people they say, "Oh, I can't use glasses," and all that ahead.
Yeah.
So yes, that one is very common according to WHO. Then we have which other one do we have? we
The
have,
ones you've seen that come up, when you're treating and diagnosing, are there some
Okay.
that you think are not really talked about enough?
Okay,
Some
now we
eye
talked about
common
it.
with the Gen Zs or millennials, or do they have generation when it comes to eye issues?
No.
Is it common with Gen X?
Okay,
than
maybe
Gen
this
Z?
generation they have this.
Yes, yes.
And you know, for the main our focus today for the glaucoma cataracts is mainly in the older generation.
The
in fact.
older
But now we
generation.
see younger people.
younger
You even
ones.
see babies that they just give birth to them, and you see they're already having cataract, they're already having glaucoma and all that.
Hello?
right?
Hello, good morning.
Good morning. I heard some radio.
Okay. I didn't hear what it said from somewhere, right? Can you hear me? All right, so please just try to call back 0805 092 0927. That's 0805 092 0927. So, going by your responses so far, you said for the genetics now, for the development, you said that one is left to fate. I don't know what you are, but for the glaucoma. All right. Hello, good morning. Hello, good morning. All right. Okay, so I think I'll just leave the phone line at this point. Now, how about, with the Hamatan comes a lot of dust. You talked
Yeah.
about protecting the eyes from sunlight.
Yeah, it's very
So,
necessary.
yeah. We always have to wear sunglasses. Is that what you're
It's very-
recommending?
Yeah, so sunglasses or just go to the clinic, check your
Okay,
eye.
this person is calling this line as well. Hello, good morning. Hello, good morning. Oh. Okay, so we talked about what's it called? The Hamatan, the dust. How does it cause glaucoma and cataract?
No.
The dust. When too much dust enter, because you said sun, so I'm like the dust.
No,
does
it's
it
sun for cataracts.
okay, it's the
Yes,
sun.
the dust and that one causes
Hello, good
another.
morning.
Sorry. Okay.
Hello, good morning. Okay. All right, so we have 5 minutes, and that's how we'll wrap it up right here. If you have eye conditions and diseases questions, you can put that on the Facebook page at Super FM Lagos, and
You can
Yeah,
visit
just
us.
answer questions. And then Ultimate Clinic, that's where this
Yes.
doctor came out from.
We have
Dr.
different
Amaka.
branches.
Well, just calm down, madam. But you see now, he's sending back. He said, I told you since 14 years, I've been to many hospitals, and
Yeah.
he's been to Lute as well.
Yeah.
And the surgeon said it's a 50-50
he said
case.
that now.
That's why I didn't do it. He said the money was ready. What can I do with a cataract? He really wants to know, because I think this
It
is
has to
affecting
still
him.
go back, because I wish he did it then when it was recommended, because even the doctor said it's a 50-50 case. Remember I said the thing about doing surgery, that surgery is always the last option. So for them to recommend it, that means they really needed it. So if they tell you it's a 50-50 case, why not go ahead
So
and do it?
50-50 means it may not come back. You may not get your sight, or you may get your sight.
Well, it's
either
better
way.
than just allowing the vision to deteriorate.
All right, I must thank your team for
We have different branches.
bringing you to come on. Yeah, I understand you're on the mainland, you're on the island, but what part do you play also in helping
Okay.
to reduce the access to eye care? And have you guys done some community outreach?
Yes,
and
we
all
do
that?
community outreach. We normally do, sometimes we even give discounts on, like, we do free medical outreach. Like, we just turned 20 in September, so we did a very massive outreach at Yaba there.
At
it
Yaba
was-
in
yes,
Lagos, and a
yes,
lot
we
of
gave
people turned up.
free this, yes.
Okay,
Mm.
all right. Okay, so now what will be the final word on this one now? What are some improvements you'd like to see in the health sector as regards eye care?
Okay. Well, as regards eye care, okay, some improvements from our side, or
No, generally.
Okay, generally,
Yeah,
wow.
when it comes to eye issues. So do you have, are there enough equipment for, when it comes to public hospitals, the health system generally, and,
yeah,
the
well,
situation with eye care?
the public hospitals I've worked with, yes, they have.
They are doing
equipment.
well.
Yes,
So
they are doing
the
well.
lawsuits and
They are doing
Lutz.
well. Yes.
Okay. All right. So you said Ultimate Eye Clinic is in Victoria Island.
Yes.
And also at Ikeja. And
Yes, at
thankfully you've
Ikeja.
done some community outreach.
Yes. Then at Ikoyi, our head office.
Okay,
At
Ikoyi as
Kefi
well.
Street. Yes.
So for releasing you to come out this morning to be on Spotlight, I must thank your team. And so what final words, what can people do to reduce the risks of, we talked about how do you reduce the risks of developing these eye conditions?
Okay, for glaucoma or
Both of them.
okay, both of them is almost about the same thing. First of all, visit the eye. You can come and visit our eye
Yeah, but I
clinic,
asked you,
yeah.
it's not how affordable is it? Because we hear that these conditions are very prevalent in rural communities.
Yes.
And we established that affordability is even a relative thing. Not everybody can.
Yes. Oh well.
Not
At least
everybody
we
can
have general
afford.
hospitals around. Yes. We
So
have
the general hospitals,
Yes.
and they are very effective when it comes to handling.
Yes. Yes. They are trying. They are doing a lot.
They are
yes.
doing a lot. Yeah.
Yes.
Okay.
And
so
if you come to our clinic, we can also still give you discounts and all
this
that.
okay.
Yes.
Well, but now, so what are the most important things that people should know about this? What are some myths and speculations about these eye conditions?
Okay.
Because some communities, do they tie it to witchcraft? Do they tie it to some
Definitely, they will tie you to witchcraft now. Village people.
They will say, okay, the eye.
Yes.
So what are some myths you just like to
Okay,
debunk? When it
Okay,
comes
so
to-
myths, especially when it comes to glaucoma. You see some people, they'll come and meet you. Oh, you're telling them, oh, it's like I'm suspecting glaucoma in your eye. They're not like, I'm using glasses now, doctor. My glasses is supposed to help to cure glaucoma and everything. So I want to say it today that glasses doesn't treat or cure glaucoma. Please remove it from your head.
doesn't treat and cure.
Or cure
It just
glaucoma.
manages it.
Yes,
Okay.
yes. It just helps to enhance your vision. Yes, for refractive error. Yes.
Okay, so are there challenges with managing these conditions?
Yes, sometimes.
So what are some of the challenges? We'll just go over like two.
Well,
of them.
sometimes patients are not compliant with the eye drops you give them to try and reduce their eye pressure. I know, yes, using eye drop is not easy, but at least the eye drop can help to lower the pressure of the eye. And when it lowers the pressure of the eye, because I think there was a case, I know a patient, so she came to the clinic where I work. So when she came, one of her eye, she was seeing very well. She could see up to the last line, but the other eye was just seeing the first big letter on the chart. So with checking her eye and everything, I discovered that her eye pressure was very high. about 30 something, 40 something. And you know, I said the range is 10 to 20 something. So we now started placing her on eye drops and all that, then scheduled follow-up visit for her. So I noticed that for her, because our own was early, because you know, we hardly close one of our eye. We hardly do it. Most times we just be, oh, as far as both eyes are open, I'm seeing. So most times for glaucoma, it's mostly when you close one of your eye, you will not see that, it's like this eye is not seeing very well. So our case, she came to the clinic early. So when we gave her eye drop, we gave her medications and everything, do you know the last time she came, as her pressure reduced, the pressure of her eye reduced, that eye that was seeing just the first big letter on the chart was already seen up to the 5th line. I was like, wow. So definitely early detection is always key.
Important. So we should always put one hand on one eye.
Yes.
To always check
you always check your sights.
That's like how you check. Okay. So that's pretty much it. What will be your parting words as regards? I know your entire team is listening to you right now, so they must be proud. In Ikoyi, in VI, in Ikeja. So what would be your parting words when as regards eye care?
Okay. Well, as regards eye care, I would say we should prioritize our eye health, not just body. The way you take care of your body, you're like, I have malaria, or it's as if I'm cold, and then you run to the clinic. Any small thing you notice in your eye, even if something just enters your eye, or you just eat your eye somewhere, I feel just run to the eye clinic. Go to the eye clinic. Just check, make sure everything is intact.
Okay.
Don't just assume that, I can still see, so definitely I don't have to visit any eye clinic.
Okay. Thank you very much, Dr. Amaka. What's the last name? Ogbudu.
Ogbogu.
Ogbogu.
Yes.
Okay, all right then. Yeah. Thank you so much, and thank you to Ultimate Eye Clinic. Hopefully you guys do more outreach to touch the lives of Nigerians.
Yes, we will definitely
help to reduce the cost of eye care so that everybody doesn't go blind.
Everybody has access.
Everybody has access to these things
and comprehensive eye
care. So big thanks to your crew, and hopefully we'll see how we can even continue this awareness journey together. All right, it's been Spotlight on Super FM 92.7. I am Kimberly Obiebo. Thanks to Ultimate Eye Clinic. Thanks to the callers, and the message. Well, she says you just have to follow up with the doctor, and you have to stick to the surgery. All right, then that's it. The sports crew takes over shortly. Don't go away.